And welcome back to our community. I'm now talking with John Bolton. He is the director at Pines Behavioral Health Services. John, welcome to the show.
Thank you, Tim.
John, we're talking about mental illness here, and one of the things that came up off camera, and that was, what are some of the contributing factors that lead to mental illness? Is it stresses of everyday life? Is it, dietary? I mean, what are some of the common problems?
I think you've hit on a couple of them that are contributing factors. I think also it could be based upon your makeup or your ability to deal with things, which is a learned behavior also. I think that there's varying degrees of mental illness. Anxiety can be situationally depressed, as can be depression. But when it becomes to the point that has gone on for a long period of time, is taking over your life and you can't function, that's when you need to seek more treatment alternatives, whether that's an outpatient setting with medication or an eventual inpatient short stay. All of those are part of a continuum of services to deal with any problem.
I think you also find, too, that there's some people that just don't want to deal with that problem, and then they kind of go into their own little shell and really don't communicate at all with people about some of the issues that they're facing.
That's true. It's not uncommon for us to see people who withdraw from all their families and friends, who aren't able to work, who maybe are able to function enough to work but come home and isolate themselves from everything, and you don't see them again until the next morning when they go to work. It causes some bad behaviors, some bad thoughts. Sometimes a psychotic intrusion can occur, and that's where you may need to seek treatment.
And then a lot of times, it's that conversation and maybe the combination of medication that really can help that person, I want to say get out of that funk, but get out of that problem at that time? Correct.
And I think we're very blessed in our community to have a large continuum of services, both from Pines, from clergy who are of assistance, the hospital emergency room, and the inpatient psychiatric unit. We all don't need just to go to an inpatient setting. We may find other alternatives, including Pines, which can assist us in problems and divert that hospitalization. At our agency, we also have social workers, psychologists, counselors, case managers, nurses, psychiatrists. It is a large team approach to try a variety of things to help you.
Well, because I would imagine that the mind is something that, it's not like a broken arm.
No.
You can set a broken arm and put it in a cast and you pretty much know how that's going to heal. Where with the mind, the brain, it is such a complex in nature that it's really hard to define from one person to another.
It is. No two people are exactly alike. And you're right. A broken arm, I can put a cast on you, or the doctor could, and you'd be fine X amount of weeks later. With an emotional disturbance or mental illness, you may take a period of time, months, sometimes a year, working through various issues and retraining yourself how to deal with things, and also being able to accept things and work upon them.
John, if I realize that I'm having issues, maybe I'm not quite thinking right, or I have certain thoughts, or I'm just depressed all the time, and I'm, again, secluding myself away from everybody, what would be the first step for somebody?
But I really think that we have emergency services available 24 hours a day, and we're available for anyone to call in during the day and ask questions or schedule an intake to find out what's going on with me, how serious is it, and what can be done to assist me. And I think that's the best place to start, is calling in during the day. We usually, at nighttime, we're having the emergencies that are occurring, and then we may be involved with the community health center of Branch County, the emergency room, or even the psychiatric unit at that point.
Do you also get calls from family members? I mean, is it something that a family member can refer somebody to, or do you have to have that person kind of join in and say, yes, I'll go?
Well, it's not like on television where you see the interventions occur, where they surprise people and drag them off. That's not what happens. We really need the person to call and say, I'd like to talk to someone or have some assistance. We will take a call from a family member if they want to express concern about someone and talk about alternatives, but we need to talk to the person who is having the issues. But then once someone comes into us as services, we also cannot talk to the family about what's going on without their permission. So if mom or dad wants to call and talk about our brother Harry, we can't talk to them about him because it is confidential.
Well, and that allows the person that is having issues to be able to express themselves without being judged by a family member or somebody. And they're like, well, I don't want to tell them because all they're going to say is this, where really non-judgmental, you're trying to get to the root of the problem to help solve or to help them maintain.
That's correct, and sometimes family members may be part of the problem. It's hard to know until we start talking to the individual.
So John, to kind of recap everything, there are outpatient services, inpatient services, we've got Pines, we've got the Community Health Center, Branch County. Can you bring all the services together for me like that?
I think we are blessed with a wide continuum. We have many systems that are informal. The ones you have mentioned are more formal services. Okay. We have many ministers in the community who will talk with people and see if they can assist, and if not, then they refer to a more formal system like Pines. We have a continuum of services from situationally based or small problems to the larger problems, psychosis, mood disorders, bipolar. And when those become unmanageable in the community with therapy or medication, then we would seek admission to the inpatient unit for a short stay. And then we'd follow them when they come out.
Should I call the hospital or Pines first, or doesn't it make a difference?
I think you call either if you want some information, and then we work well together and can refer back and forth.
So really a complete program if you're out there having issues. There's a lot of people and a team of experts here to help me.
Correct.
John, thanks for being with us.
Thank you, Tim.
All right, John Bolton, he is the director at Pines Behavioral Health Services. Again, we've got the phone number on the screen, so if you are having issues or know of somebody and you'd like to get in contact with somebody, you can give the phone number a call. I'm Tim Hart, and you're watching Our Community.